my channel, All Things Psych. My name is Brittany. I am a licensed clinical psychologist and an adjunct professor. If you are watching this video, then likely you are looking for additional EPPP study tips. Well, you've come to the right place. I can help you with that process. So, without any further delay, let's go right into today's video. Hello everyone, and welcome back to another video. In this video, I will briefly go over the strategies for remembering the treatment options for Tourette's. To begin, know that in 80% of cases, antipsychotics such as haloperidol and pimezide are effective for managing the symptoms of Tourette's. I like to remember haloperidol by calling it holoperidol. So hold, helping me to remember that you are grabbing hold of those symptoms. Now, as far as pimezide, I emphasize the first part of that word and think of pin-nozide, and I think of the phrase put a pin in it. So quite literally to hold until further notice. So we kind of have a little bit of a cross-reference here. So just think of these two medications are effective in taking hold of those motor and vocal tics. So just kind of as a quick review, when you see haloperidol, think of hold peridol, grabbing hold of symptoms. And likewise, when you're seeing pimezide, think of pin-nozide and the phrase put a pin in it. Another point that I found somewhat helpful, when I look at pimezide, I think of pinball, particularly the pinball machines. Pinball machines were very popular in the 80s, and that reference was helpful in remembering that in 80% of cases, haloperidol and pimezide are effective for treating the symptoms related to Tourette's. So moving on, we managed with the use of SSRIs. In particular, these SSRIs are effective for alleviating the OCD symptoms that oftentimes accompany Tourette's. Now, one useful way that I make that association between Tourette's and OCD, at the first part of the word, tour, I like to imagine a major world music tour, and just know about music tours in general. The same routine is performed over and over and over again, maybe with some slight variation, but just think of a long music tour where the same performance is given again and again. So that repetitive behavior, again, is our reference point for OCD, and just emphasizing tour and Tourette's helps me to remember and make that connection between Tourette's and OCD. Continue on, inattention and hyperactivity are often seen in Tourette's, so I want you to make sure you're not mistaking these symptoms for ADHD. Also know that if an individual presents with inattention and hyperactivity and they have a diagnosis of Tourette's, psychostimulants can actually exacerbate the motor and vocal tics. So a way to remember that, think of giving caffeine to a toddler. That's a big no-no. It's the last thing you want to do. So that can be a good reference for remembering that psychostimulants can actually exacerbate tics. So instead, an effective way to treat the hyperactivity that can accompany Tourette's is to provide these two medications here. Well, one or the other. So Clonidine, which many of us are familiar with, I like to refer to Clonidine as Calmidine. So I like to make that reference of calm and referencing that you are trying to calm down those hyperactive behaviors. And here we also have the Zipramine. With the Zipramine, I like to emphasize the word zip in there. So we see here the zipramine, and I think of the phrase zip it. So you are quite literally wanting the individual to put a zip on those behaviors and vocal and motor tics. So a final treatment option, this is of course a behavioral treatment option, comprehensive behavioral treatment for tics, also known as CBIT. I like to remember this being associated with Tourette's, and thinking that we can see a bit of improvement in symptoms. So CBIT, see a bit of improvement in symptoms. And some of the key features of CBIT, one being habit reversal training. So emphasizing the bit and habit reversal training is a good reference for remembering that habit reversal training is a component of CBIT. And with CBIT, you can see a bit of improvement in symptoms. Some other key components of CBIT are also relaxation training. So again, referencing bringing about calm and inducing calmness, and of course, psychoeducation. So that is all I have for you for today. Hopefully this information was helpful for you. Don't forget to like this video and subscribe to this channel for more helpful tips and everything else psych related. In the meantime, happy studying.